Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing cosmetic or aesthetic surgery in the Scottsdale Paradise Valley area for over 22 years, and all I do is perform aesthetic or cosmetic surgery. One of my most favorite things that I do are facelifts or facial surgery, and I feel lucky that people come from all over the country, even the world, to see me for facelifts. And like a slice of the population, I don't only see particular ethnicities. I see people of every kind of race and walk of life. And people want to know, how do the facelift differ in different ethnicities? Are they better? Are they harder? Do they last longer? And I think the first thing to understand is that the whole perception of beauty, I think, is different for each ethnicity. And I think the important thing for a patient to communicate with me is what they think is beautiful. I think that the needs are different in different people. There are some patients that may want to have their eyes made a little bit different. There are some patients that may be a particular ethnicity that don't want their faces so full. I find that a lot of Asian patients have different needs than African American patients. So the most important thing is to communicate and get an idea of what it is that you think is beautiful and make sure that we have the same shared aesthetic vision. I think the other thing that's important is to go over before and afters, because that gives you an idea of what the plastic surgeon's capabilities are, and also what their perspective is in terms of beauty. There are some ethnicities in terms of, whether it be Asian or African American, that tend to have more difficulty with wound healing in terms of scars, but that has not been really my experience in my practice. I think that the facelift tends to be under very, very little tension when it's performed appropriately, and scarring tends not to be an issue. If there is an issue with scarring, generally it can be dealt with either with some steroid injections or a revision in the office, usually about a year or so. Other things in terms of ethnicities, there are some patients that may need particular implants, whether it be fat transfer to create volume where we think that we want to put it, or particular implants, whether it be a chin implant. I always like to have patients go through a whole process, no matter what ethnicity they are, in terms of bringing in some old photos of what they looked like, in terms of what they think is beautiful, and going into a magazine or something, and then going through my before and afters to find any particular kind of patient. It may not be the same ethnicity, but you may feel as though that patient's face speaks to you in terms of what it is that's bothering you. So again, I think this procedure, no matter what ethnicity it is, needs to be individualized, and there are many ancillary things that I do to create a beautiful result, whether it be fat transfer, whether it be some kind of procedure to the eyes, whether it be a canthopexy, it could be a chin implant, it could be doing something in terms of laser resurfacing, but overall I think the end result, it should be something that you feel is beautiful, that you feel is your secret unless you want to tell people about it, and you feel that you look very natural and younger. So who doesn't want to look younger and prettier? Thank you.